you know, it's a lot. But I actually worked for Jim after working for a council of governments and doing community and economic development for a number of years there. And then I went to work at the Center for Community Health Development, where I was able to add in the health perspective of the community development type of work. And so we're going to talk to you a little bit about that today, and particularly how you as a hospital, a rural hospital, can engage your community to do planning, to do implementation, to do partnership activities that can improve population and health, but also help sustain your hospital system.
We're going to focus on the warts and pimples and failures that we can bring to the table, because while we can talk theory and models and all that kind of stuff, I think what's going to be most useful for you folks is to hear the real side of what works and what doesn't work, which is why we're going to, as Cassidy said, allow as much time as we can for questions and answers, and hopefully you'll bring us some real specific challenges that you're faced with that we can provide some response to. As Angie said, we've worked together for a number of years, and we're going to share some of those experiences, good and bad, as a part of this conversation. So I'm just going to jump in, and Angie and I will be doing sort of tag team. So if she interrupts me, she's not being rude. She's just going to add something to what I've said that maybe needs some correction or modification or clarification. So we're just going to proceed that way, and I'll feel free to do the same thing to her, only
absolutely,
probably a lot less frequently. So when we talk about community engagement, there's all kinds of definitions out there, and that's fine, but it's important to think that community engagement is a function of setting. You need to pay attention to context or where that communication is going on. Are you talking about at the community level within the community, or are you talking about between a community and a particular organization? I'm going to talk from my experience of about 10 years in hospital management and 15 years in the consulting world working with hospitals. So a combined 25 years or so working with hospitals, largely involved with what we didn't call community engagements, but working with communities. Now we have a name for it. I didn't know that the first 20 years of that. But it's also important to understand within an industry, or certainly by location, community engagement can mean and look very different. But basically, it's a noun. It's describing an action. It means doing something, not just talking. It's stronger than participation. And again, if you've sort of followed this idea over the years, we've gone from things like community improvement to community engagement, to looking at lots of different ways of thinking about how do we interact. But it's no different than any two of us talking about our relationship. Angie and I, our working relationship, has had good and bad points, strengths and weaknesses, effective communication, not so effective communication sometimes, and that's just part of any normal relationship. We're talking about exactly the same thing when you think about your institution and the community or the context that you're based in. So today, to make it simpler, we're going to talk about community as place-based, although as you all know, and more, we're paying attention to social media and electronic communities and how groups of people completely spread across the earth can be part of a community that an institution might be dealing with related to a particular disease or whatever.
Very similar to what we're doing today is working with groups of hospitals across the state through a WebEx.
Very good, very good. Okay. So when we talk about community engagement, it's purposeful. It's a series of activities that we implement specifically with the intention of building or increasing communication and collaboration between different community stakeholders. And by stakeholders, we're going to talk about in our examples lots of different cases. We'll go through some very specifics, but in general, we're talking about people that hold resources or people in positions of leadership that are typically stakeholders. Although, as you'll see, that's a very narrow kind of a definition. Fundamentally, though, community engagement is about a long-term commitment that may include some short-term wins, but it's always focused on long-term impact. Where are we going? How are we trying to get there? Community health development is a strategy or an approach that guides community engagement because it's really focused on two simultaneous goals. One of those goals is improving population health status by reducing risk factors or increasing health status specifically through access to care or preventive screening or other kinds of activities. But simultaneously and equally important to any population health improvement are these community health development strategies to help us build community capacity to solve problems. So just as if you were working with me as an individual patient, you not only want to treat me for a particular disease or condition, but you want to build my ability to more effectively resolve or address the next issue I'm going to be concerned with. So you help me quit smoking, but now you've got to help me manage my stress better, help me eat better, et cetera, to improve my health status. It's not a single one-shot perspective.
And a lot of times when we're working in communities, when we're talking about building capacity, it's building capacity of different groups perhaps that haven't worked together before to address a problem, or maybe not worked together before to address a health problem that really is a community health problem. So it's not that folks or organizations don't necessarily have capacity, it's just that they haven't worked in a way to build their capacity as a partnership.
Right. And I want to jump in here with enlightened self-interest because I think that's a concept that we really don't have time to talk about extensively today. But one of the fundamental tools for getting different groups of people to work together is to try to understand what their enlightened self-interest is. What is the thing they need to get out of participating in some kind of a community activity? The easy example is elected officials. They're looking for votes. They're looking for public visibility so they can get reelected. Agency and organizational personnel are oftentimes looking at a mission. What is the thing we're supposed to do? We're fighting cancer or heart disease, or we're promoting this treatment or procedure or institution. But enlightened self-interest requires us to go out and talk to all those individuals, try to understand what is it they need, what is it that they want to get out of contributing their time and energy and resources to any activity. And sometimes that's very protective, a very defensive posture. All they're really trying to do is protect their turf. That's a little more difficult to work with. But if you can identify in a group of people collectively what those enlightened self-interests are, and then identify or develop a strategy that incorporates all of those things so that the mayor gets the visibility he or she wants and the school district gets whatever they're looking for, and law enforcement, et cetera, all those various players can get something out of this, then you have their combined resources available to you to solve the problem. And it's not just the hospital stuck out there trying to deal with X problem without anything except their individual resources to work with. So why bother? I think you can probably already hear in our voices, this is not an easy task. This is something that requires taking a long view and looking at problems and solutions from a broader perspective. Community health development does that. It helps us do that, and as I mentioned already, by focusing on improving health status and increasing capacity at the same time, what you end up with then is exponentially greater. You're solving problems, but you're also increasing problem-solving ability. So it doesn't matter whether you dealt with the issue of teenage pregnancy one time, or substance abuse, or poor public transportation. The next problem that comes along, that community is better able to address what are the elements to identify the problem, identify what are the elements of how you might go about solving it, and then actually carry it out.
So the strategy that we have most commonly used is something we call the partnership approach, and we've done this in several communities, particularly in Texas. Jim's done a lot of work outside of Texas as well. But it's a strategy that we use to engage the community, and it relies upon a series of actions and interactions between different community stakeholders that basically leads you back to the assessment process. So it's assessment, it's planning, it's implementation of whatever those plans are, evaluation of the impact of those plans, and again, back to assessment. So here's a really busy slide, and it's evolved over the years, but this is one of the slides that we have used quite often to talk about the different phases for the partnership approach. And as you can see, we really start by working with the local community to frame the strategy. What is it that you want to do? Who needs to be at the table? And that's kind of a preliminary stage, and we're going to go through each of these steps in a bit more depth. But it's identifying what the initial priority is to get people around the table, and then confirming some of those concerns and priorities within the community by conducting an assessment, then pulling together, again, people on a more formal approach to trying to determine what it is that you want to address, how can you address it, how are we going to plan to address it, and then moving into the next phase of implementing interventions or initiatives to address those priorities that have been identified, monitoring the progress, the status, determining the impact of what you've done, which will lead you back to phase one to be able to go to that next step of addressing the next need. Sometimes these things are happening simultaneously. The community should always be involved, and that's what we're going to focus on today as we move through this partnership process.
So as Angie said, that preliminary analysis, that first phase, is sort of when you when you parachute into a community and try to get the lay of the land. Who are the key players? What are the key issues that people are concerned about? That may not be the problem you end up working on, but oftentimes you need to, well, not oftentimes, you always need to understand what does a community see as its concerns and issues. If you're a rural hospital that's facing closure, that may not be the issue that community members are most focused on, because you're still here, you're still delivering services, and no matter how threatening it might be to you from an internal perspective, they don't see that yet. They may see that the mayor's wife developed breast cancer, and that's a horrible thing. And so we should be doing something about breast cancer in our community, because she was a favorite person in that environment, and appropriately so. They were concerned about her. But from an epidemiological point of view or from a community process point of view, breast cancer may not be the biggest issue in that community. So how do you get people to change their focus from what's sort of the immediate concern of the moment to an issue that they can actually do something about in a relatively short period of time, to be able to demonstrate to themselves that, in fact, the value of collaboration is really an important and beneficial approach. So we typically start off by looking for somebody or some group of people who can function as community champions. They are in every environment, and oftentimes you discover that the champions of one thing are the champions of everything. The people that tend to be chairing committees are chairing multiple committees. They're the movers and shakers, the folks that know how to get things done, and everybody wants them on their committee. So they're not easy people to get a hold of. I mean, to engage. You can get a hold of them. You can find out who they are easily, but their initial reaction may be, I don't want to be on another committee, or your problem is not my problem because I've already got plenty of things to worry about.
So, and really, when you're talking about a community champion, you're looking at somebody that can convene a group, that can start a process, because as Jim's saying, particularly in a rural community, if you're looking for somebody to help lead a process, oftentimes that person is the busiest person in the community. But it is also somebody that generally is seen as very credible within the community, right, has the community's trust, has a large network, so that when you're working on addressing whatever issue is at hand, you'll be able to disseminate information, communicate clearly, and have that person be the face of what you're doing. So that means that you will have to provide a lot of support for these activities, but to be able to make it an easy ask, or I guess an easy answer for the champion to say, yes, absolutely, I'm willing to help you with this, and I will convene this effort.
I'm thinking of an example where a local mortician was that champion, and not somebody you probably put on your list of, well, gee, who do we want to run our health initiative in this town? But he was an incredibly well-respected individual. Everybody knows him, small enough environment that, he probably did half the funerals in town, maybe more than that, but had everybody's ear, well-liked, didn't have any kind of other agenda, and when there was an opportunity to step up and provide leadership, he was the first one to say, sure, I'm ready to take this on. And an absolutely marvelous example of how somebody who wasn't particularly skilled at organizational stuff or planning, or didn't bring a lot of technical skill to the table, but brought all the personal charisma, legitimacy, and stuff that we as outsiders couldn't have had, because we were new to that environment. If you want to add anything to that.
Well, and absolutely, because of the work that he did a lot of community work. In fact, was mayor of the small town for a while. So he was used to processes. He was used to facilitating meetings and engaging people in processes. So it worked out really well for us to be able to have him be the initial champion of the work that we were doing.
Yeah. Do you think of any other examples?
A lot of times, particularly in Texas, we have approached county judges. Yeah. And one of the reasons that we do that, particularly in rural Texas, is that everybody knows the county judge. The county judge, although although the county judge kind of oversees the entire county, it's really those unincorporated areas of the geographical boundaries, because if there are cities within the county, of course, those are led by city councils. And so what we tend to do is we work with the county judge because they are familiar with most of the county, including the cities. It's also a good way to disseminate information across that geographical boundary. So a lot of times we will go to that individual first, and we'll talk about opportunities we may have, resources we may have to bring to bear to address whatever community challenges they have. And we have always done this when we have gotten ready to develop a formal community assessment. So we may have identified the champion. That may or may not be, for instance, the county judge, but whomever that champion is, then we approach generally a small circle of identified leaders that the champion actually helps us identify, and we talk about the next step in this process, which would be to conduct a community assessment. And then they become our planning committee for that piece of this process. So Jim is actually the expert in conducting community assessments, so I'll let him talk to you a little bit about the process that we use.
Only because I'm significantly older. Yeah, community assessment is a great tool for doing two things. One, it's wonderful data, it's wonderful information to have, but even more valuable is its role as an organizing tool for bringing people together. Even when you have competing hospitals, for example, where they may not exactly like cooperating or working well with each other, if you can get them to joint venture or participate in a community assessment, everybody, as they say, all boats rise with a tide, whatever the cliche is. Anyway, everybody benefits from having better data. That really becomes an important and useful tool. Community assessments can be done lots of different ways. All of you nonprofits know that you've got to do your 990 form and your community assessment every 3 years. You may or may not know that local health departments that are looking at becoming accredited go through that same kind of a process. Lots of FQHCs have to do a periodic assessment. United Way organizations do a process. And if you can link those up where all those organizations are participating in the same assessment, you can dilute the cost across multiple organizations, which is a plus. But you also gain a lot of credibility that it's not just the hospital's assessment or the United Way's assessment, but it's the community's assessment. And that group of community champions you brought together, along with some technical expertise you may need to bring in from local college or other places that have folks, a nursing school or something, where they have some personnel who can help with the technical side of it, is really, really valuable. We're not going to go into great detail on community assessment because, again, we could do hours and hours on that. But the outcome of that assessment is two things. As I said, data that we have that allows us to talk about what are the factors that are driving health status in a particular environment. And secondly, is that organizational infrastructure that now owns the output. I used to tell my consulting clients, hospitals, that the dumbest thing you can do is conduct a community assessment by yourself, because when you identify that poverty or poor public transportation or lack of jobs or some other issue is the primary driver of poor health status in your population, what are you going to do? Buy buses and hire drivers? Probably not. So if you've got a community partnership that co-own that outcome, then maybe you've got some organizations that could step up and say, well, we have churches that have school buses sitting on weekdays, or a school district that we could work with, or other entities that might be able to help.
So I think that we'll go through the rest of the steps real quickly. As Jim said, the assessment itself, both the preparation and the process of conducting the assessment, and then presenting the findings to your community, are a fantastic way to organize your partnership. We're going to talk about each of these steps in a little bit further detail in the next few slides. So I'm going to go ahead and move on to that. And we'll talk about how this starts. We talked about this a little bit already, but Jim, go ahead and let folks know about how we generally started this process.
Well, again, when you start talking to people, I default to my consulting years, and I think about arriving in places that I perhaps had never been before, and you need to go around and get the lay of the land, and so you talk to people like the cab driver on the way in from the airport, although we don't have cabs anymore, but that was a great methodology.
Uber.
You talk to the people at the check-in desk at the hotel. You look for a local newspaper that's got information you can, in 15 to 20 minutes, get some idea of what are the issues in that community. And then you go and talk to, well, the people that have invited you in. Is it folks from the local hospital? Are there just staff people there, or are there physicians? Are there board members? Are there other folks you can talk to? And then how do you draw that circle out so that within a day or two of being on site, you may talk to 20 or 30 people who give you a great deal of insight into what's going on in that environment, or at least the differences in perspective about how people see that. If the cab driver says, oh, this place is going downhill, there's nobody coming in anymore, or nobody tips anymore because the economy's bad, that may be a totally different perspective you get from the Chamber of Commerce person who says, oh, this is the nicest town in the state, and everybody's moving here, and all these wonderful businesses are coming in. And both of those are correct perceptions from the individual's point of view, but part of the challenge that we have is to try to sort those things out and come up with a cohesive picture that allows us to think about how we're going to try to affect health status in that environment. What resources are there that are available?
And as a hospital team, you are hearing this every day within your community, and really what we're doing at this point is confirming that these conversations that you're having obviously are very, very important, and that can help lead to a guide for how you assess the community more formally as part of this partnership process. So we like to say, or maybe I like to say, I came up with this, I won't give Jim credit for the corny saying, solving means involving from the beginning. That sounds a little bit touchy-feely, I realize that, but we really do believe that if you're going to develop community-owned, community-sustained solutions, community has to be involved from the beginning. I learned very early on in this work that coming in and bringing resources and planning and developing an initiative all on your own means you own it, good and bad. And one of the worst situations I think I was ever in is when we went into a rural community. We partnered with a free clinic that had a hub in the small metropolitan area, and we said, hey, bring your clinic out here, maybe come a couple days a week. You can have your PA come. We can pay for that PA's time to see folks on Thursday and Friday. Clinic said, great, we can do that. But we, being the interface with the community, and I was at Texas A&M at the time, at that time already, and we told the community we were working with a nonprofit, but we were the face in the community. So we brought that nonprofit out there. We helped them set up the clinic. And then when the nonprofit decided, you know what, we just can't sustain this. Our board of directors doesn't support us having this clinic anymore in this community. So we'll still see these residents, but they'll have to drive 45 minutes to come see us at our free clinic in the small urban hub. So what did that mean for us? It meant that we came up with a solution. We didn't have a plan for sustainability. And even though the university wasn't providing the clinical services, who do you think got the black eye for those clinical services going away? Well, it was us. So it was a little bit of a challenge that became a credibility problem for us. We were trying to develop this trust, this relationship with these community members and helping them address these healthcare problems. But we hit a snag right away within the first year. So we had to do a lot of extra work to be able to make that happen. And one of the solutions then became, okay, if they're not going to be here, then we have to figure out how to get them there. And we did come up with a volunteer-based transportation system to get those people there. But it's so much harder on the back end when you realize you haven't put together a plan to sustain what you're doing and involve the community from the beginning, because it could have been that the community could have come up with its own solution, maybe helping to pay for the PA, maybe helping to pay for support for that organization to stay in that community. But we went out on our own at that point in time and made this deal happen, and we did involve the community. So that's why it is so important to make sure the community is on board, because when you do hit that kind of road bump, it's a community issue. It's not any one organization's issue.
So I'm going to move us along because we're burning through our time here and talk about some of the participants in community engagement. And there's 75 more hours we could spend on this topic without any trouble at all. So we're giving kind of a slice across the top here. But local stakeholders come in all flavors. Sometimes we think, about board members as the kind of people that represent our community, and certainly they do represent the community from one particular perspective. But it's also important to remember that you are also one of those local stakeholders, and that's how you're seen. So this is a little table that kind of shows some of the different broad categories of sectors of the community. Sometimes we ignore local government if we're not a government entity. The schools and obviously the hospital and clinic. Some of these organizations, though, that we don't necessarily pay attention to are things like local law enforcement. But just take a minute and think about how much of the mental health services in your community are actually provided in the back of a squad car. They may, in fact, be your local mental health service provider. And what relationship do you have with them besides perhaps the nurses in the ER who know them really well because they see them, 11 o'clock every night. But what do you know about the local police chief or sheriff's perspective on how you might go about solving problems?
So we already started down the path of conducting a community assessment, and we let you in on some of our organizing tactics with that. It really is, an assessment really is an opportunity to get a snapshot of your community. I'm thinking of Snapchat already. With the younger generation, they might consider it a snap of the community rather than a snapshot. Not many Polaroids around anymore. But it also is an opportunity to confirm what you already probably know about your community, what those priorities are, and document that. And that will be really important as you get into the planning process to have a documentation of priorities, and even later when you're looking for external resources to help support some of the plans that you have. Typically, a comprehensive assessment will provide you with a ranking of community issues, priorities, but it will also identify community resources that can be brought to bear in any kind of intervention or initiative that you want to implement later. Very important also to understand the historical community context. Some of you have lived in these communities where you worked for many years and you have that information, but some of you may also benefit from, oh, this is why we've been doing this like this. We were in the center, were in a rural community not too long ago where there was some animosity that had been in existence for years and years and years based on where the courthouse was. So these things are real, and people still react to that, and they still have perceptions about their neighbors, the people that they work with, based on often long-time historical happenings. So
even the football rivalries, Texas can be make or break, factors in whether people get along or even talk to each other or not.
Friday night lights are real.
Yes.
Absolutely. So, and then finally, you want your assessment to garner some type of advice from the community. You want to know who should be involved in addressing these types of community needs. What is the best way to communicate with community members throughout this process? Again, our assessment components that we use here generally include surveys, existing data, maybe from the Census Bureau. We will look at demographic data, maybe from the CDC, Centers for Disease Control and Prevention. We'll look at chronic disease data. We'll also have community discussion groups that range from anywhere from 10 to 20 folks to talk about several different community issues. Key stakeholder interviews, particularly with key leaders. We will conduct those as well. As Jim's already mentioned, many of you are required to do a community health needs assessment along with a community health improvement plan. He also mentioned that local health departments often will conduct assessments for new or continued accreditation, and there are a host of other organizations that will either sponsor an assessment and will collaborate with you, or they're also required to do an assessment.
So one of the things we do when we've gotten to that stage in organizing a partnership and conducting community assessments, we hold something called a regional health summit. Typically, it can happen in different formats, but the most general example is where we bring folks together, present the results of the assessment, and then break them into work groups to deal with various topics, the priorities that have come out of that kind of an assessment. That public forum gives us a chance to not only talk about what are the problems in our community, but really the emphasis there is focusing on what can we do short term? What are some solutions to actually deal with the issues we've identified? Then we also go on we would encourage you to go on the speaking tour and go to the Chamber of Commerce, go to the Commissioner's Court in our case, whatever kinds of other events, the Tuesday, breakfast Rotary Club, you get your 14 minutes on their agenda to do your assessment report. Those little windows can be hugely valuable long-term in terms of getting people in various sectors of the community, different stakeholder groups, to value not only the fact that this assessment was done and we have this data, but there now is an organized effort in our community to deal with my issue or my concerns, whether that's mental health or substance abuse or kids running around or old people dying.
And locally, we like to call that the pancake tour because they're usually 6:30 breakfast at a Chamber of Commerce event. So we've gotten pretty adept at making those. And this is also the point where you have the opportunity, once you've presented these findings, to engage additional people that are specifically experts or have resources or are just really passionate about dealing whatever has been identified as your priority for your health partnership.
And that's one of the next important points is that you have to move from an assessment to a plan. The Affordable Care Act requires an implementation plan, but doesn't give very much guidance as to what that's supposed to be or how it's supposed to work. But I think it's pretty obvious. I don't think this really requires a lot of sophistication to translate understanding what are the factors that influence health status to what can we do about those kinds of factors. So sometimes you need a skilled facilitator, sometimes you need somebody from the outside, but oftentimes you've got those folks locally. They may be on your staff, they may be, as I said, a faculty member at a local junior college or high school or someplace who just has those communication skills and can be that point of contact to bring people together, have a conversation, and to move that forward. How do we get people to invest in working toward improving our community?
And I think one of the important points that we make early in the slide is that you want to work with the community to identify both what we call low-hanging fruit. Perhaps there's been an issue identified with the fact that most people don't know about certain services that are available to them. And one of the things that you could do very easily is work with either an existing information and referral group or develop an information and referral work group to figure out how to get information about services, whether they're hospital services or social services or senior services, together to be able to put that out through social media or a website or whatever. And then some of the things that are going to take, and that gives you a quick win, again, with your community. You ensure that the community sees that you're working, that you've had some immediate success, and that allows you some time to start to address some of those issues that may take a couple of years to address.
So the next slide talks about sort of the obvious points about why we have to implement this plan. I mean, it has to go into effect. And the one after that talks about evaluating impact. The step that's in between is when we talk about how do we get that information out effectively to groups of people. I'm thinking of an example of a community in Georgia where we worked, where the editor of the local newspaper was very skeptical of the community assessment process we were doing. He's one of those guys who just didn't want to believe anything, and we were from a carpetbagger Yankee consulting firm from Pennsylvania at the time, and he thought we were scoundrels, is the term he used. So he looked very skeptically, and he sent a reporter to every single community meeting, every single activity, and they wrote kind of lukewarm articles, kind of kept the public up to date. But when we got through, he was gentleman enough to stop and say, I was absolutely wrong. This is tremendous value of our community. What can I do to help? We said, well, why don't you put an article in the paper every Friday that summarizes a different section of the assessment? And he did that for 6 weeks. Front page above the fold, the major city newspaper, and had huge impact on the adoption of that assessment by not only the local hospitals, but other groups of people. All right, Ange?
So really, just to reiterate that, it's very important that this process is transparent. It's very important that you communicate not only with the stakeholders that are at the table early and often, but also with your broader community, whether that, again, is putting articles in the newspaper, whether it's social media, going on radio, or just word of mouth. Go to the coffee shop and talk about what you're doing and make sure that people are able to ask you questions directly. So this process then brings you back to the assessment. Once you have evaluated what you've done, it gives you the opportunity for your partnership to look at tackling other healthcare or community priorities. And so what you'll want to do as part of your partnership is plan for regular assessments, so it doesn't have to be every year. I know for hospitals, that's generally every 3 years. But again, it takes you through that process, but even more important than that, you've developed the infrastructure now, and you've created some efficiencies in being able to conduct the assessment and plan and implement and evaluate.
What you're likely to see actually is little sub-coalitions that will split off, not split off in a negative sense, but will take up an issue and begin to work on that sort of independently under the umbrella of the larger partnership, but not necessarily locked into the same timeline, because they're going to discover there's something we can do very quickly to deal with a particular issue. We don't need to wait for a 3-year cycle to come back around again. And that can be an incredibly exciting and energizing phenomenon when you see a community starting to take and internalize this kind of process and begin to run with it without you providing the energy and the resources necessarily to make it work.
So this is the close of our presentation, and this is actually my favorite part, is when we get to tell you some real-life examples of community engagement activities in the rural communities that we've worked in. I predominantly worked in rural communities. Jim's worked in a mix of rural and urban communities. So we want to give you a little bit of a reality check.
Yeah, so the truism, if you've seen one rural community, you've seen one rural community. They may all look exactly the same if you're the carpetbagger from Pennsylvania, parachuting in, but you spend about 10 minutes on the ground and you realize this is very different than the last place. It looks from a demographic profile that I checked online before I got here, from the place down the road where we heard very, very different things about groups of people or history of that community. And, when they're on the west bank of the river and it floods every year and you can't get across, that's a very different experience than the people on the east bank of the river. So sometimes it goes to almost geographical features that determine community history and characteristics. So you need to understand, you need to know that community.
Once you have a partnership assembled, you're bringing people from all walks of life to start to do planning processes. And what we've learned through the years is all these folks bring a different language. For instance, a lot of the work that I've done has been working with Texas A&M University in rural communities. We can get lost in the academic-ese, as we like to call it. It's always interesting to see a faculty member stand up, a faculty member who is used to writing a 250-word abstract that has a 25-word title, talking to a group of,
Wait a minute.
Oh, sorry, no offense. Talking to a rural community and reminding them that they're talking a different language. One of my favorite individuals that I ever worked with was a county commissioner from a small rural community in Texas. And in the meeting, he would like to paraphrase things. So if you said something, he would come back and say something like, "Oh, I get it. He's got the football, but he's not really sure which end zone he's supposed to be running to." Or, "Oh, this is like nailing Jell-O to the wall." I actually had a graduate student that wrote all these things down, so we were actually going to come up with a book. So I'll have to contact her to see if we want to pick back up on that. But it's always fun. It's always interesting. But you have to remember, if you have somebody in a healthcare provider, they may start talking in medical terminology, and you need to make sure that they're relaying that in a way that everybody at the table can understand what they're talking about. Same thing if you're working with social services providers. You can get into the ABCs of agencies and organizations, and I've even had partnerships that I've worked with that said, please, can you give me a list of acronyms and write out beside it what that means. So we do that even to make sure that people are all on the same page when we're working through a partnership. The other thing that, as many of you know, because this is probably true for many of you, that in rural communities there are fewer people wearing more hats. So you're not only competing with your other priorities, but also everybody at the table has other priorities that they're trying to keep up with as well. So you have to consider that when you're planning, when you're facilitating, you get to your meeting, you stick to the agenda, and you move on so people can get to the next place that they need to be.
Yeah, there's an old saying, you want the busiest people to be on your committee, and they're the ones who have the least time. But that's the case. Something that's really important is that to understand, to think about it, trust is earned. I may show up because I'm an old guy with a beard and a PhD, and there may be some people who think that deserves some respect. Maybe that's true, maybe it's not, but it doesn't deserve trust. That has to be earned, and that's something that you only happens when you do what you say you're going to do. And it doesn't matter what institution you come from. It took me not too long to discover that when I said I'm from Texas A&M, that wasn't necessarily seen as a positive thing in some of the surrounding rural communities that feel like they've gotten the short end of the stick time and time again when the university shows up and we want to study you and we'll write a grant, and maybe that happens and maybe it doesn't, but they never hear anything as a result of it. And some of you, I'm sure, that are listening in, you're nodding your heads with that, based on that experience.
And there's always opportunities to continue to engage folks. And sometimes when you invite people the first time to join your partnership or come to a meeting, they may pass, but that's okay. Keep them informed. Let them know what's going on. In one of the rural communities that we worked in, we actually had a grant to go in and develop what we called a health resource center. And I had just come to the university after working with the Council of Governments locally. And so I knew the county judge in that county, and I made an appointment to go visit with him. I was so excited. And I went in, and he said, "My goodness, Angie, where have you been? I haven't seen you since you left the Council of Governments. What are you doing here?" And I said, "I came to talk to you exactly about that, exactly what I'm doing in your community." And he says, "Well, now, you know, people only come to see a county judge for two reasons. One, they want to complain, or two, they want money. Now, which is it?" So I had to be honest. I said, "Well, I don't want your money today because we have a grant, and I'm going to tell you what we're going to do with that money and how that's going to benefit your community. But at some point, once we get this established, it's going to have to be supported by your community." And he said, "You know what? I'm fine with what you want to do," after he listened to my little spiel. He says, "But I got bigger problems. I got unpaid roads. I've got people that can't even get to the doctor if they wanted to. I've got employees that are turning over. This is just not my priority." I said, "Well, okay, I understand, but I'll be back." So a couple of weeks had passed. We were getting ready to do the ribbon cutting of this health resource center that we helped establish in that community, and everybody was there. We had the mayor, we had the hospital folks, we had the chamber, we had everybody that had helped us in this process. And just as the scissors were opening and we were getting ready to cut the ribbon, the door opens and a light shines down the hall, and there's the county judge. He is thrilled to be there. This is going to be one of the best projects that has ever happened for his community, and he knew it was going to make an impact. So I continued to keep him informed after that date. I continued to let him know how many people had been served by this health resource center. And at the end of the grant, which was a 3-year grant, I went to see him again. And I said, "Now, Judge, I'm here, and I told you I'd be back. And here's what it's going to cost to keep this health resource center running." Well, I was fortunate because he was not running for office again. He was retiring after several terms. He said, "You know, this is budget time." And I said, "Yes, sir, I know this is budget time." And he says, "Here's what I'm going to do. I'm going to pay for half of that. Now, I'm going to pick up the phone, and I'm going to call the city manager across the street, and I'm going to tell him that he's going to also give half." I thanked the judge. I walked across the street. The city manager opened the door. He said, "I already know. I've already got it in the spreadsheet. We'll present it to council and workshop today." So again, it's being persistent, it's being transparent, it's showing the impact, and getting folks involved in sustaining what you start. Having said that, one thing to know is that some communities just aren't ready, and despite your best efforts within your community, you may not ever get them to the point that you want them to be able to address a particular challenge, and that's okay. You have to figure out another route. It's challenging. It can be done, but you keep going back. You keep showing, particularly, what the outcome would be if you didn't do something about whatever is at hand.
So even with Angie's amazing persuasive powers, some communities just aren't ready. Self-interest change, funding streams change, things happen that are out of everybody's control, and you also have to figure out when you're just beating your head against the wall versus being persistent, and there is a difference between those two. The last point I want to make is, and it goes back to what Angie said as well, is you need to build in sustainability. Day one, she talked to the county judge. he knew that 3 years later we were going to be coming back and asking for money. Don't surprise people with, oh, how's this thing going to run? We sort of helped start it up and got you all excited about it, and now we have no idea how it's going to keep going. That's not a problem that you want to dump on people if you want to continue to work in that environment. You have to think about from the very beginning, how is this going to be sustainable, and actually perhaps require some great creativity and other skills. So I think, okay, real quick commercial. Center for Community Health Development, our website, cchd.us, has lots of background material and other resources on community assessment, on health resource centers that we've talked about, and the overall process we've been talking about. I know Cassie's going to do a commercial for their website before we get done, I'm sure. Questions and answers, right? That's what's next?
Right, absolutely. So if you have questions, please go ahead and type them into the chat box, and I will read them aloud. You're somewhat anonymous. All we need is the question. We don't have any questions at this time, so I'll give everyone a couple of minutes. And I will go ahead and plug our website again while you guys are typing your questions. But you can view our past webinars and also see summaries of future webinars that we've outlined for the rest of the year on our website, which is optimizingruralhealth.org. It's pretty easy to find those. We've had some great webinars. Angie and Jim will also be presenting another webinar for us in a couple of months, so you'll definitely want to check that one out again. I still don't see any questions, so I'm going to kind of prompt you guys because you've got two really knowledgeable people here at the table, and as we've been working with the hospitals that we are providing technical assistance for, I don't think we have had one call with one of those hospitals that did not in some fashion bring up community engagement and barriers to community engagement. So I know there are questions out there because we're getting them every day. So I will kind of prompt you guys. Does anyone want to maybe type any unique stakeholders that they've brought to the table that maybe weren't in the summary that was on one of our slides, like law enforcement? Has anyone brought law enforcement to the table? You can simply say yes, or maybe just identify stakeholders that maybe weren't really obvious. If you want to share a story, we would love to hear that. You can just let me know in the chat and I will unmute you, and we would be glad to hear about maybe a recent community assessment that you did. Okay. Need to get EMS and hospitals to talk to each other.
Great example.
Yeah.
You think about two groups that ought to be intimately in conversation. I don't have a story about that, but I can tell you about lots and lots of hospitals where I asked the CEO who was in charge of their FQHC, and they asked me, what's an FQHC?
Wow.
Yeah, grimaces around the table. You know, it's or a group of community I can think of right now, 7 hospitals, where all 7 hospital CEOs had never met each other. How do you operate in that kind of environment? But that's not uncommon.
Yeah. Someone mentioned fire department.
Great.
Are there any resources you recommend for good, reliable community assessment scales?
Come to our website.
So Jim, is it the website that's on right now?
Yeah, cchd.us.
cchd.us. There's some great resources
There'll be some
there.
publications there. You can look at lots of other community assessments, and happy to talk to you about any of those components.
Great, and we'll share a link to that in the email that goes out with the survey after this as well.
And I think just to add to that, you know, we know that there is a lot of existing data out on various websites, which is fantastic. The challenge is that a lot of that data is not relevant to smaller rural communities. Even the data that exists on some websites that are focused at county level, you don't get those smaller municipalities and their particular concerns. And so I think it's always important that to look at that existing data, but it's very important to actually speak to people as well, if you're able, through focus groups or community discussion groups or interviews, to have a really good understanding not only of what those issues are, but to determine how people are willing to be engaged in addressing those issues.
I will challenge my students to tell me what are the 5 leading causes of death in the community if they're assigned a community project. And before they answer, I said, the answer is going to be the same for every community in this group. 99% of the communities in the United States, major leading causes of death, the same 5 things. So why do you need to do a community assessment if you already know what the major leading causes of death are? And the answer is, we don't need to know what the causes of death are. We need to know what are the solutions to preventing those deaths. And those are going to be different from one community to another. So it's not necessarily epidemiological data that we need. It's understanding the community and how that community works and what will and won't work in that environment that we need to understand. So I think that's a really good point, Angie. And the county health ranking, some of the other data that's out there is fantastic. Some of it's a little sketchy. You have to pay attention. But in general, you can get a lot of information in the abstract. What you don't have if you rely on that kind of a resource is qualitative data, the information you get from talking to people. You talk to a couple hundred people in a rural county, and you have a pretty good idea of what's going on there. And you could survey those same 200 people and not really learn anything you wouldn't get from typing the county name into the County Health Rankings website and generating a report. So.
Yeah, absolutely. Darla says clergy are great stakeholders to involve.
Great, yep.
And then we have a question that says, what process or not have you used for validation of community assessment? Well,
let me tell you a story. I remember doing a presentation to a hospital board that was not particularly, the assessment was not particularly positive about the medical community. There were a lot of complaints about the doctors. And so the physicians in the room were not positively predisposed to this conversation. Let me just say that's enough of the background. And we were talking about these community discussions we had, and we were hearing from people about accessing care and a variety of other things. And one of the doctors said, well, this is just people's perception. These are not facts. And I said, well, but if people believe they can't get care in your emergency room because they don't have health insurance, they're not going to go to your emergency room to get care. That's their perception, but it's also their reality. So don't discount someone's perception or beliefs as not factual just because it didn't come out of a survey. So validating data can mean lots of different things. The survey may be, and the quantitative data may be the weaker element from a validity point of view than the actual qualitative data you're able to get. So I was assuming some things about the way the question was asked that may be unfair, but that's an important distinction to make.
Great, thank you. And then we have a couple of more. Unique challenges in working with sovereign tribal nations.
Wow.
I can imagine.
I don't have any experience at all with that.
Yeah.
I mean, we worked in a number of communities that had Native American populations, but they weren't recognized tribes like Lumbee, North Carolina. The Lumbee Indians really struggle because they don't have that designation. That's the only one I can think of off the top of my head, so I really can't be very helpful. Angie?
No, I haven't done anything with tribal nations. But we certainly have folks that we have worked with that have. So if there are specific questions that you have, please let us know, and we can get back to you. You can send an email through the website, and we can provide some feedback for you there and some resources.
Absolutely. And then comments on cultural barriers to engagement. Anything on the top of your head about cultural barriers to engagement?
Well, I'll use the obvious example. Since we're not on video, I have to explain that I'm a 71-year-old, 6-foot, bald white guy with a beard. People make assumptions when I walk into the room, especially if I'm introduced as Dr. Burdine from Texas A&M. Good and bad, those assumptions may be right or wrong about how I believe or what I think is right or wrong, or who I value or who I don't value from a personal perspective. I may not be the right person to send in to an African American church meeting that we've been invited to do a community discussion group. I'd like to think that I'm an open-minded person. I'm going to be recognized for what I bring to the table and all that kind of stuff. But I completely understand if they're going to be a little hesitant to speak about some of the community issues that they may feel really strongly about in that situation. Being aware of who you are and who you're talking to is really critically important in that kind of a conversation. You may or may not be the right person to lead that discussion. You may not know till you get there. I remember walking into a group that I thought was going to be Hispanic men in a suburb of Newark, New Jersey. I walked in the room and every face was black. These were folks from Puerto Rico, not African American, black men who were from Puerto Rico that spoke Spanish that were meeting at a Catholic church. I had a whole different imagination in my mind of what a group of men Hispanic men at a Catholic church in New Jersey would have looked like and what their life experience was. So, you know, you never know till you walk in the door what the advertised characteristics are going to be or not. So.
And let me add to that, particularly when we're doing community assessment, what we tend to do is use both our community volunteers that have already come to be part of our planning group for the assessment that maybe is the basis for what will become the partnership. We have, for instance, well, I can remember exactly one instance where Jim and I had gone to a local rec facility and we're trying to determine how we were going to start a discussion group, and we weren't having much luck. It was a predominantly African-American community, area of the community, but this one individual looked at us and wanted to know a little bit more about what we were trying to do. Turns out she was the leader of the local chapter of the NAACP. And after we talked to her, she became very excited about the idea of doing this assessment and listening to people and coming up with solutions. So we recruited her to the team. She was not a paid member of our staff. She already had a job, but she agreed to help us reach out within the community, and we actually asked her to help us organize discussion groups, help us train other people to be facilitators of these discussion groups, because neither one of us would have been the person that would have elicited the best response probably, or even the most honest response about what their community priorities were for that neighborhood. So we do a lot of that because we're at an academic institution. We're able to call upon students, graduate students in School of Public Health often. We take them through a process of training. And again, we have a great diverse group of students that will go in and be able to have conversations as well. The challenge with that then is when you go into a community and you have a younger individual, particularly with an older population, because that presents different problems, right, when you're looking at age and experience. So sometimes, you know, again, you go back to relying upon your partners and making sure that they're trained. And that's why we engage with the community even prior to doing an assessment, because we want to make sure we're assessing the depth and breadth of the community, and also having everybody at the table for that process from beginning to end.
Great. Any other questions? We don't have any in the chat box right now, and it is 1 o'clock, so we want to be respectful of your time. So I think we'll just go ahead and wrap up, but one last question. Have you used information to engage with state or federal legislatures?
Yes. Certainly when we're talking about...
Texas, after all.
This is true. When we're talking about being able to secure resources to help support some of the things that you're trying to do locally, or just wanting to make legislators aware of what those priorities are, we absolutely do invite, usually it's staffers, usually they're the ones that have the time to attend meetings. We've had staffers that will come to focus groups, discussion groups as part of the assessment. We will always keep them on an email listserv, if you will, to keep them informed, and we will help communities craft messages to their policymakers so that they can meet with them to talk about their community issues. So that's always something that we have as part of our repertoire, I guess, of ways to engage community.
Great, good question. Well, I think we'll go ahead and wrap up. If you have follow-up questions, please feel free to email us, and we'll try to get it answered by one of the presenters. But Angie, Dr. Burdine, thank you so much for being with us today. This will be on our website shortly, so you can share or listen again at your pleasure. Thanks for joining us, everyone. Bye-bye.